Hello again. This is Dr. Natasha Harvey again, obstetrician and gynecologist. I just wanted to make a follow-up video on the last video I made just to address two more things that I wasn't able to get in the last video. In particular, I wanted to discuss some of the presenting symptoms for the COVID-19 virus for pregnant patients, which is a little bit different or a little bit atypical than a commonly presenting patient with COVID. So because the symptoms are a little bit different, these can be masked or unrecognized until later stages. In particular, pregnant patients already have some respiratory compromise where there is a condition called dyspnea of pregnancy or shortness of breath of pregnancy that's pretty common, especially in the third trimester and beyond. So considering that, when a pregnant patient complains of shortness of breath, this could kind of be brushed to the side. Additionally, pregnant patients may present with some symptoms that may classically look like a condition in pregnancy called preeclampsia. Preeclampsia is a condition where blood pressures are elevated and there's protein in the urine, and there's some other signs like liver dysfunction, etc., that a pregnant patient can present with. However, because we're so commonly used to treating preeclampsia, we will treat that underlying disorder, not necessarily thinking of COVID. And there have been a few studies that have pointed out that a pregnant patient may present with low platelets or elevated liver enzymes, which is commonly seen with preeclampsia, but also you should have a low index of suspicion if there's any other presenting symptom that the patient should be screened for COVID. The second part I wanted to address is just the emotional toll of all of this in pregnancy. So as I mentioned in my earlier video, there's a lot of anxiety that pregnant patients face just in regards to keeping herself safe, keeping her fetus or her baby safe, and now to think about bringing your newborn into this world where there's no vaccine yet, there is no cure per se for this disorder. There's a lot of emotional stress that this can bring to a pregnant patient. Additionally, we've also socially isolated them, so that's also an issue. They're not allowed to see their families or get the added assistance that they could possibly get from getting a second hand postpartum. So I just wanted to encourage in pregnancy to reach out to all your resources, use your resources. There's still availability of telemedicine visits, even postpartum. So if our patients are struggling with mood, anxiety, depression, reach out to your physician. You can still have a visit by telemedicine. We can still set you up with the appropriate resources for mental health, for mood, anxiety, and postpartum depression, because that's a real thing. And we're gonna probably be seeing that a little bit more and more. Okay, thanks for listening. Bye.